Hello and welcome. Humans and microorganisms have developed together over tens of thousands of years. Microorganisms such as bacteria are in our soil, our water, and our food. They exist on us and in us. They play a critical role in our ecosystems and our very survival. However, under specific circumstances, some microorganisms have the capacity to make us ill and even kill us. Over the course of human history, microorganisms have been a leading cause of illness and death all around the world. It's really only been the last 90 years that widespread effective antibiotic treatments have become available. The proliferation of antimicrobial treatments has literally revolutionized both human and animal health, as well as life expectancy. But that's not the end of the story. Microbes, like humans, adapt. Microbes have developed the ability to resist our treatments, a phenomenon known as antimicrobial resistance, or AMR for short. Left unchecked, we will continue to see dramatic rise in AMR infections. Finding ways to address AMR on a global scale is therefore both important and urgent. It's why we're here today. Hello again, everyone. My name is Paul McDonald, and I have the pleasure of serving as today's host. Please note that French translation is available today, and all you need to do is hit the interpretation button that you'll find on the bottom bar of your screen, and then select French. Now, before we begin our formal program, it's our custom at York University to pay tribute to our Indigenous ancestors and partners. As this event is virtual, and we're not all gathered in the same space, I recognize that this land acknowledgement might not be for the territory that you are currently on. We ask that if this is the case, that you take responsibility to acknowledge the traditional territory you are on and the current treaty holders of that land. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Tkaronto has been taken care of by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Today's event will consist of remarks by some distinguished guests, followed by a period where all participants will be invited to ask questions of an expert panel. When the time comes, please use your Q&A function that's found at the bottom of your screen to write out your question. We'll try our very best to get to as many questions today as possible. If you're a member of the media with a question, please, we ask that you include your affiliate name at the beginning of every question that you submit. And also please note that the chat function on your screen has been disabled, so that if you have any technical issues, please again use the Q&A function to communicate with a member of our staff who will then do their very best to try to help you resolve it. Now, with these housekeeping items established, I'd like to invite President Lenton, Dr. Tam, Professor Hoffman, and Dr. Rogers Van Katwijk to enable their cameras at this time. And it gives me pleasure to call upon York University President Rhonda Lenton to provide opening remarks.
Thank you so much, Paul. Good morning, everyone. Bonjour, bonjour. On behalf of York University, I want to extend a warm welcome to everyone who has joined us today to celebrate this very exciting milestone. I would especially like to acknowledge Dean Paul McDonald of York's Faculty of Health, Dr. Teresa Tam, our Chief Public Health Officer of Canada, Professor Dame Sally Davies, the UK Government Special Envoy on Antimicrobial Resistance, Dr. Peter Singer, Special Advisor to the Director General of the World Health Organization, and of course, Professor Stephen Hoffman and Dr. Susan Rogers Van Katwick. For those of you who are not part of the York community, I want to welcome you to York virtually. I very much hope that one day soon, we will have the chance to meet again on our campuses. I want to say that I've been incredibly inspired by the way that York University students, faculty, and staff have come together over the past several months. They have not only mobilized and adapted to online remote classes, professional work, and research, but they have also remained unwavering in their commitment to supporting each other and the local and global communities that we serve. In fact, it was in April, only a month after we moved to remote learning, research, and work formats, that we learned that York had been ranked 33 out of 767 competing universities from around the world in the Times Higher Education Impact Rankings. The ranking is determined based on how a university's research, stewardship, outreach, and teaching have contributed to progressing the UN's 17 Sustainable Development Goals. I mention this today because our impact is central to how York measures our success. There are many ways that York makes an impact and drives positive change in the world around us. By providing a broad demographic of students access to a high-quality research-intensive university, ensuring that future skills are met, and of course, through our research and innovation activities, the impact of which is amplified by the partnerships that we have established between our researchers and leaders from industry, government, and not-for-profit organizations around the world, tackling complex global issues like homelessness, systemic discrimination, climate change, and COVID-19. One absolutely excellent example of the success that is possible through this kind of multi-sector collaboration is the Global Strategy Lab. Led by York professor Stephen Hoffman, the lab has a long-standing record of conducting research to inform policies related to the pressing challenges of AMR. The Toronto headquarters of the lab are housed within York's Victor Philip Dadala building, adjacent to the new Dadala Institute for Global Health Research. The lab draws upon the full strengths and resources of both York's Faculty of Health and our Osgoode Hall Law School, where Director Stephen Hoffman is jointly appointed. And so it gives me great pleasure to be here today to celebrate the 1-year anniversary of the Global Strategy Lab being designated a World Health Organization Collaborating Center on Global Governance at Antimicrobial Resistance. WHO collaborating centers develop global thought leadership, increase the evidence base for policymaking, and ensure collaborative knowledge generation. By designating the lab as a collaborating center, WHO has recognized the outstanding work that the Global Strategy Lab has been doing to call attention to the issue of AMR and to find ways to assess the problem and address it on a global scale. The research of the Collaborating Center on Global Governance of Antimicrobial Resistance is focused on global governance, including developing new ideas to rally political support and accountability on global commitments, and providing policy analysis and legal advice on global governance arrangements to protect antimicrobials. Working with institutional and academic partners around the world and using an interdisciplinary approach, the Center identifies solutions that help the WHO face the challenge of AMR. This work is critical and timely, and the Center benefits greatly from the strong leadership and dedication Professor Stephen J. Hoffman and Dr. Susan Rogers Van Katwijk provide as the Center's director and managing director, respectively. Stephen and Susan, it is my pleasure to congratulate you both on this exciting milestone as the Global Strategies Lab designation as a WHO Collaborating Center marks 1 year. I want to thank you so much for the important work that you are doing. I wish you and the entire team the very best for continued success. It is now my pleasure to introduce Dr. Theresa Tam. Dr. Tam was named Canada's Chief Public Health Officer in June of 2017. She is a physician with expertise in immunization, infectious disease, emergency preparedness, and global health security. As the federal government's lead health professional, Dr. Tam provides advice to the Minister of Health, supports and provides advice to the President of the Public Health Agency of Canada, and works in collaboration with the President in the leadership and management of the agency. Dr. Tam, we are incredibly grateful for the leadership that you have provided since your appointment, and particularly over the last number of months in the face of the COVID-19 pandemic. Thank you so much for making the time to join us this morning.
Thank you, and merci, President Linton, for those kind introductions. I would like to acknowledge that I am participating from Ottawa on the traditional and unceded territory of the Algonquin Anishinaabe people. Thank you, Professor Hoffman, Dr. Van Katwijk, for the invitation, and the Global Strategy Lab at York University. What a great way to mark World Antimicrobial Awareness Week. And I'm really pleased to be here to just share a few thoughts about antimicrobial resistance. We might use the acronym AMR, more than you could possibly count, perhaps, during this particular event. But I'll touch on the importance of global collaboration and the One Health approach to combating AMR. Just like COVID-19, AMR does not respect borders and has the potential for devastating economic, security, and sustainable development outcomes. This pandemic that we're all living through is showing us what our lived experience could be in the future if we do not take steps now to prevent and control antimicrobial resistance. So COVID-19, I think, definitely serves as a wake-up call that global collaboration is the most effective way to tackle complex public health crises and challenges like AMR. As well, COVID-19 has demonstrated the importance of governance in order to advance commitments made, including those within the WHO Global Action Plan on AMR. This is why Canada, along with many other members of the global community, advocates a One Health approach to AMR. We have to consider the intersections between the use of antimicrobials and the development of resistance in bacteria and other organisms found in humans, our food animals, pets, and the environment. In taking this One Health approach, Canada is focusing on 4 key pillars across all sectors: infection prevention control, surveillance, stewardship, research, and innovation. We are also taking into account the global nature of AMR and the impact that the national and international decisions regarding trade, agriculture, economics, and the movement of people and animals and health can have on its containment of spread. We recognize that AMR jeopardizes the attainment of the United Nations Sustainable Development Goals. So clearly it has a negative effect on goals related to promoting health and well-being, clean water, and sanitation. But AMR may also derail other SDGs or Sustainable Development Goals, including those related with food security, as well as decent work and economic growth. So in 2018, the World Bank reported that the global economic impact of AMR is differential, with AMR being costlier for lower income countries than for high income countries. So left unchecked, AMR has the potential to slow the growth of economies across low to high income countries. Canada remains a strong supporter of collective action on AMR, and we continue to be active and engaged in multiple international fora, including the Global AMR Research and Development Hub, the Transatlantic Task Force on Antimicrobial Resistance, what we call TETFAR, and the Global Health Security Agenda, AMR Action Package. Domestically, we remain committed to advancing the Pan-Canadian Action Plan for AMR in collaboration with federal departments, colleagues, but also our provincial territorial partners and many others. And through these platforms, we aim to share evidence, lessons learned, and best practices in order to inform our own actions to address AMR and to strengthen the global community's approaches to this issue. So I would really like to congratulate York University and the Global Strategy Lab at their recent designation as the WHO Collaborating Center on Global Governance of AMR. So we really looking forward to their work to help bolster international efforts in addressing AMR, to bring more attention to the issue, to expand the evidence base on global governance, as well as leveraging networks and relationships to support our collective actions. Some of you might know I've been a bit of a champion for social behavioral research as a key to address AMR, because it provides a much better understanding around the factors that influence antimicrobial use from patient and provider perspectives. And this research is really helpful to shift societal norms from the current patterns of antimicrobial use. And the leadership that the Global Strategy Lab and the work that they're undertaking in this regard, I'm sure will help immensely in terms of informing and evaluating these behavioral interventions and mobilizing knowledge. And so I'm really looking forward to the work being generated in that area. So just to sort of have a bit of a final wrap-up reflection, antimicrobial resistance is a public health issue that can affect anyone, whether we're individuals, communities, governments, and all of us, every single one of us has a role to play. Globally, we can solve this problem through collaboration and coordinated action by working together through a One Health approach. Canada and its international partners can leverage collective lessons learned to reduce selection pressure, to reduce the use of antimicrobials in animals and humans, and preserve the effectiveness of antimicrobials in the future. There is no doubt that we're living in a very unusual time, and COVID-19 has shone a light on some of the pre-existing inequities that are pervasive in our systems. And I was trying to point to this in my recent annual report. But I also pointed to a range of unintended consequences that are much broader than the direct impact of COVID-19. So I'm really cognizant of the fact that one of the key concerns being expressed is exacerbating AMR when patients with COVID are given antimicrobials, sometimes with no great indication of a co-infection. But I really see COVID-19 presenting major opportunities to leverage the momentum being gained through international collaboration. So we've been talking in Canada a lot about rapid diagnostics, which I think some of the developments there could be very relevant to our AMR actions. Our public understanding on infection prevention control, from hand washing to other practices, has greatly increased. I believe and I really hope that with improved intervention in our healthcare systems on infection prevention control. I was sort of speaking with domestic partners about wastewater surveillance. And I know that's an area, for example, not just applicable to SARS-CoV-2 detection, but also antimicrobial detection, for example, which I think we had a bit of a difficulty sort of starting that kind of project, and maybe we can leverage these platforms. And so certainly the international multi-sectoral collaboration, which has been unprecedented, whether you're looking at vaccine research and development, and equitable access to important interventions and innovations, I hope will serve us really well as we tackle and continue to tackle antimicrobial resistance. So I say in Canada, together we can do hard things. I firmly believe that the community and the people participating today can each play our role in dealing with this really tough problem. Thank you.
Thank you very much, Dr. Tam. On behalf of all Canadians, let me just express our gratitude for your continued leadership. You're a person who is clearly making a huge difference in the lives of Canadians, and we thank you for that. It's now my pleasure to introduce my colleague and the leader who's responsible for the creation of the York University WHO Collaborating Center, Professor Stephen Hoffman. Dr. Stephen J. Hoffman is a Dadala Distinguished Chair in Global Governance and Legal Epidemiology and a Professor of Global Health, Law, and Political Science at York University. He's the Director of the Global Strategy Lab and the Director of the WHO Collaborating Center on Global Governance and Antimicrobial Resistance. He holds a courtesy appointment as a Professor of Health Research Methods and Evidence and Impact at McMaster University. And he's an international lawyer licensed in both Ontario, Canada, and New York, who specializes in global health law, global governance, and institutional design. He was previously an associate professor of law at the University of Ottawa, an adjunct professor of global health and population at Harvard University, and former visiting fellow at the University of Oxford. May I present Stephen J. Hoffman.
Great. Thank you very much, Dean McDonald, for the introduction. Thank you, everyone, for joining us today. It's really an honor to be directing this WHO Collaborating Center on Global Governance of Antimicrobial Resistance, and a real honor to be here today with some of the people I most admire in the world. Dame Sally Davies, Dr. Peter Singer, Dr. Teresa Tam, and all my colleagues at the Global Strategy Lab and the Dadala Institute for Global Health Research, who together have worked in developing this WHO Collaborating Center and supporting the World Health Organization in addressing this global challenge. I'm going to keep my remarks brief because I really look forward to the panel discussion around the global governance dimensions of this challenge. But I did just want to emphasize that one reason, or the main reason, that I spend so much of my time and my research on antimicrobial resistance is that I just see it as one of the defining challenges that we currently face right now. And I say that because this is a challenge that defies public expectations around the way things should work in healthcare and in public health. By that, what I mean is, for a long time, we have just depended on the fact that when we get sick, when we have an infection, there will be antimicrobials available to us to help fight those infections. And unfortunately, over the past decades, as we've seen microbes evolve to become resistant to those medicines, and as we've seen the pipeline of new antimicrobials dry up, it's resulted in a situation where increasingly those infections that we've long just assumed just require a pill in order to address, or several pills to address, suddenly it's no longer working. And indeed, in some cases, there's certain diseases that have become totally resistant to our existing antimicrobials. Now, why is this collaborating center focused on global governance of antimicrobial resistance? The short answer is that this is one of those challenges that no country can address in its entirety without working with other countries. Of course, there's many issues around the world that are like that. Climate change, protection of the oceans, air pollution. But this one, I think, is of in particular interest because it is one of those things that actually equally affects everyone, in that this is antimicrobial resistance does not discriminate on the basis of income or race or religion or geography. It affects all of us. Now, the downstream consequences, of course, are concentrated among those who are already facing conditions of marginalization. But the reality is this is one of those global issues, those tough global issues that could actually affect each individual, our families, our children, and everyone we care about. So it's important that for everyone that we tackle it. The last thing I'll just say is that when thinking of antimicrobial resistance, if there is this reality that microbes don't carry passports, they travel between countries, we need countries to work together to address it. What that means is that we need a science of global strategy around how we can address this global challenge that defies borders. And the starting point for any global strategy needs to be the World Health Organization. This is the world's leading public health agency responsible for health around the world. And to address challenges like this, I think many of us in global health always say that if we didn't have a World Health Organization, we would need to create it with great urgency, because it is that agency and the thousands of people who work for WHO and who work with WHO every day are heroes in promoting our health around the world. And so for that, I'm really honored to be having able to be part of this partnership between York University and the World Health Organization, and really excited to mark World Antimicrobial Awareness Week with all of you today. So a big thank you. And with that, I'll pass it over to my colleague, Dr. Susan Rogers Van Katwick, who's an epidemiologist and the managing director of the WHO Collaborating Center. Susan.
Good morning, everyone. As Dr. Tam has already said, this week marks World Antimicrobial Awareness Week. And that's a time when we really come together to raise awareness and to encourage policymakers, healthcare workers, and the public to take action to stop the further spread of drug-resistant infections. And it's a fantastic moment as we mark this first anniversary of our WHO Collaborating Center to think back a bit on some of the work that our team has done in the past, working with the World Health Organization to assess global progress on the development of national action plans, and last year hosting a meeting with experts and policymakers from around the world to develop a roadmap for sustainably governing the global antimicrobial commons. But this year's theme for World Antimicrobial Awareness Week, it's also a call to action. The World Health Organization and partners at the UN Food and Agriculture Organization, the World Organization for Animal Health, are really calling attention to the need to stay united and to work together to preserve the effectiveness of antimicrobials for people all around the world. And our collaborating center has been tasked with two challenges in that respect. The first is to conduct research on new ideas to rally political support, to strengthen accountability for the commitments that countries make on the global stage. And our second role is to provide the World Health Organization with policy analysis and legal advice on global governance arrangements that are needed to protect antimicrobials. And we'll be able to do a lot of really exciting work under those two pillars. So we are looking forward to leading projects that explore the similarities between antimicrobial resistance and other global challenges like climate change and COVID-19. And we hope to draw out useful lessons from these other big global challenges that can help us tackle antimicrobial resistance in the future. We'll also be leading a project to help develop a unifying global target, the kind of target that will help rally support for action on antimicrobial resistance and act as a sort of barometer for progress towards global goals. Already this year, we built a phenomenal team of interdisciplinary researchers, staff, students, and affiliates who are engaging with us on all these projects. And that includes other York University professors like Dr. James Orbinski, Dr. Adrian Wiens, Dr. Mathieu Poirier, and Dr. Mary Viktorowicz. And with this absolutely all-star team, we are really looking forward over the next few years to building our collaboration with the World Health Organization, with researchers, with policymakers, and with the public as well. So I think we're really excited about that. And without further ado, I think I'll turn it over to our wonderful, illustrious guests for this Q&A session.
Thank you very much, Professor Hoffman and Dr. Rogers Van Katwick, for your remarks and inspiring leadership through all of this, and also for sharing your important mission and agenda of the new center. While I read you the impressive bios of our guests, I would invite Dame Sally Davies and Dr. Singer to open their cameras at this point. And they, along with Professor Stephen Hoffman, will form our expert panel. But let me introduce Dr. Dame Sally Davies, who was appointed as the UK government's special envoy on AMR in 2019. She's also the 40th Master of Trinity College and Cambridge University. Dame Sally was the Chief Medical Officer for England and Senior Medical Advisor to the UK government between 2011 and 2019. She's become a leading figure in global health, including serving as a member of the WHO Executive Board from 2014 to 16, and as a co-convener of the United Nations Interagency Coordination Group on AMR in 2019. This past New Year's, Dame Sally became the second woman and the first outside of the royal family to be appointed Dame Grand Cross of the Order of Bath for services to public health and research, and having received her DBE in 2009. Dr. Peter Singer is a special advisor to the Director General and Assistant Director General of the World Health Organization. Dr. Singer, among other things, was the architect of the WHO strategy and its triple billion target. He provides leadership to the Secretariat of the Global Action Plan for Healthy Lives and Well-Being to strengthen collaboration among 12 multilateral agencies to accelerate the health-related sustainable development goals. Prior to his current appointments, Dr. Singer served as the Chief Executive Officer of Grand Challenges Canada and the Sun Life Financial Chair and Director of the University of Toronto Joint Centre of Bioethics, as well as Professor of Medicine at the University of Toronto and a Senior Scientist with the University Health Network. He's recipient of the Michael Smith Prize as Canada's Health Researcher of the Year in Population Health and Health Services, and an officer of the Order of Canada. He's a fellow of the Royal Society of Canada, the Canadian Academy of Health Sciences, the US National Academy of Medicine, and the Academy of Sciences for the Developing World. Please. I'd like at this point, as our panelists settle in, to invite all people joining us today to prepare and submit your questions for our distinguished panel. Just a reminder to use the Q&A button found on the pop-up bar at the bottom of your screen. While you're submitting your questions, I'll get us started with a couple of questions that have been on my mind. To each of the members of our panel, what's the one thing you wish that everyone knew about antimicrobial resistance?
Gosh, what a question. Let me start by congratulating York University and my friends Stephen and Susan for being awarded a WHO Collaborating Centre and all their work they're doing on AMR. It's important, and this is key in global health security, so congratulations. What do we wish everyone knew? Well, actually, I rather wish they knew what antimicrobial resistance was, even if they don't call it AMR. We've done a study recently in the UK, and only 19% of adults thought that it was a serious threat. And very many people think that the resistance is in them, the human, rather than in the infectious organisms, the bacteria or viruses. And when you consider that we already have a slow pandemic of AMR, which will be, if we don't get on top of it, even more serious than COVID-19, this is tragic because we can act, but we've got to act now, or we won't deliver the sustainable development goals. So I wish they knew about it. I wish they understood, and then I'll stop, the true value of antibiotics. We have to think about antibiotics as critical infrastructure for our health systems and our sustainable food chains. And if we get empty medical cabinets because of resistance, because of poor supplies, stockouts, and we just haven't got them, then we're going to have more complex medicine, more expensive medicine, and more deaths over and above the at least 700,000 a year dying from drug-resistant infections at the moment.
Thank you. Maybe I'll just jump in. I also want to join my friend Dame Sally in warmly congratulating York University. It's terrific to be with you, President Lenton and Dean MacDonald, and congratulations on your leadership. I also want to congratulate Professor Hoffman and Dr. Van Katwijk. I know Professor Hoffman very well. He's a great combination of emotional intelligence and more conventional intelligence. And really appreciated the warm words you had about WHO. And to Dr. Van Katwijk, I want to use something that you said actually for my one thing I wished everyone would know about AMR, because you just said it. Before I do that, I also want to join you, Dean MacDonald, in just acknowledging the terrific work that Dr. Tam is doing on behalf of all Canadians. And in particular, you know, COVID is a story of inequities. And I was so pleased that she'd focused her last annual report on inequities, and redressing those inequities hopefully will be the hallmark of the recovery. On to the one thing, the one big thing. You know, we started with an Indigenous land acknowledgement, and Dr. Tam also did an Indigenous acknowledgement. Indigenous peoples understand the holistic nature of humans and the environment. And that's maybe the one thing that I wish people really would understand. I think there's a lot that we can learn from Indigenous peoples of Canada in relationship to antimicrobial resistance. You know, we've called it One Health, but there's a much more vibrant sense when we tap into traditional ways of knowing and being. And in that regard, the thing I wanted to land on that Dr. Van Katwijk said was talking about AMR and climate and COVID as a set of convergent challenges. And I really wanted to flag that this is very convergent, if you will, with the recent thread in what Dr. Tedros has been saying. If you look at the speech he gave to the World Health Assembly last week, he talked about forging a new era of global cooperation and these challenges coming together. And even in his speech to the Empire Club yesterday, he said, we can't deal with health and climate and conflict and inequality in silos. So that type of thinking around convergent challenges, and as Professor Hoffman said, convergent solutions, I think is really terrific. It's much more robust than One Health alone, which is kind of this taxonomy of three things at the animal environment, too technical. And if we can pull around it, the wisdom of our Indigenous peoples, I think that would be just terrific. So thank you so much, congratulations. And it's a wonderful to be here with such eminent people and with this, at this very, very happy occasion, and warmly congratulate the Collaborating Center, its leaders, because leadership matters, and the leadership of York University. Thank you.
Dean MacDonald, I'll just quickly answer your question because I think Dame Sally and Dr. Singer said it so well. I'll just say the one thing that I wish more people knew about is how much mortality and morbidity, how many deaths and disease is already caused by antimicrobial resistance today. In our world, there's a lot of people who quote the figures from the O'Neill Commission, which was commissioned by the UK government around by 2050, there's the expectation that 10 million people per year will die from antimicrobial resistance, which is more people than currently die from cancer, which is of course very scary, but also very scary is that already today, at least 700,000 people die every year from antimicrobial resistance, making it as well one of those already not just major threats for the future, but a major threat for everyone living today. And I think that often gets forgotten, because often when people do die, if they die from a certain pathogen, it gets maybe listed on the death certificate, they died from that pathogen. It's not as clear they died from a resistant form of that pathogen, that if that pathogen wasn't resistant, that person wouldn't have died. And so that, for me, is the number one thing, that this is not only this future very scary threat. Today, it already is a scary threat that we're all living through. Thanks.
Thank you very much. We have a question from a member of the audience today. And the question is, should we, let's see, the first question is antimicrobial stewardship or conservation of antibiotics enough to address the global threat?
Sally, I think you're the perfect person to answer that one.
No, it's the start, and it's terribly important. We must look after what we've got. But actually, resistance will develop however carefully we look after them. And we haven't had any new classes of antibiotics come into routine clinical use that weren't discovered, by the late 80s. So we've got to do something not only to protect what we've got, which means reducing infections and using them carefully anywhere we use them, but we've also got to invigorate the pipeline. And that's a big piece of work, from R&D in universities and institutes and startups to having pull-through mechanisms so that big drug companies are incentivized enough. They don't need to get rich on this, but enough to invest in it and make sure we get new drugs. Over.
Go ahead, Stephen.
No, that was better said than what I would have said. Just that when I talk about antimicrobial resistance, I often talk about it. It's not actually one problem. At the very least, in the simplest form, it's actually at least three problems. The first is access, in that there's actually millions of people around the world who actually don't even have access to antimicrobials when they do face infection. So that's something, and at least a couple million people per year die from lack of access to antimicrobials, which of course is a travesty that needs to be fixed. The second aspect is conservation, as the question alluded to. We need to conserve the existing effectiveness of those drugs that we already have and that used to work better, and the ones that still work today. And third, as Sally mentioned, we need to make sure we have new drugs that are in the pipeline, because microbes will continue to evolve. And so we need to evolve our knowledge as well and bring new tools in this fight.
And I'll just add two things very briefly. Firstly, just to acknowledge the incredible global leadership of Dame Sally on this topic. You said she was the best person to answer the question. That's a good cue to put that point to the group. This is all I want to say on the conservation question is this isn't a new problem. And it's a problem we haven't really wrestled to the ground. I remember when I was a resident in the 1980s, figuring out that I had to give a patient vancomycin because they had methicillin-resistant Staph aureus, and then they had Reigert's. I don't know if you still get that red person syndrome from vancomycin, but the very vivid memory. And I remember scrambling around for antimicrobial, patient with sepsis, an older person with fever, sepsis, who suspected urinary source, and scrambling around to look at the senses on the bug, so the bug drug combination could be right to save that person's life. And so this is a very real problem. And I guess my question back to the group is, if it's been around since the 1980s, why haven't we been able to struggle to the ground, wrestle to the ground some of the issues like antimicrobial stewardship, which was the focus of the question. So it's a real problem, and it's been here for a long time, and maybe we should look at what the gaps are related to the question that was asked.
Thank you. We have another question that was aimed specifically for Dr. Hoffman, but I invite our other panelists to also provide remarks if they wish. And the question is, what's the role that global governments and international law can play in addressing AMR? And I get a sense they're sort of looking for some tangible examples to help us understand why these are so important as strategies.
Yeah, it's a great.
Stephen, you. Yes.
Uh, Thanks, Dame Sally. I'll answer the question, but also pick up on Peter's question, which I think is because the two go perfectly together. I think we've known about the problem of antimicrobial resistance for almost as long as we've known about antimicrobials, and so this is a decades-old problem, as Peter flags. But I think what's interesting and important is that we face a global collective action problem when it comes to addressing this challenge. And by that, what I mean is there's too many instances where we're not able to achieve the full social benefit of doing certain actions on antimicrobial resistance unless other countries do it at the same time. For example, currently, York University in Canada, we could end up spending a lot of money on antimicrobial stewardship programs in order to limit resistance in the Canadian context. But microbes don't carry passports. They don't go through border controls. So what that means is if other countries don't simultaneously make those investments, then Canada won't be able to achieve the full benefit of its investments in this space. Now, the good news is we can achieve enough benefits that we definitely need to be doing everything we can to limit antimicrobial resistance. But it highlights the collective action problem that's at play. Similarly, it's the same for investing in new medicines. It would be great if all countries together were investing in the development of new drugs or new technologies for conservation, but we might have a free rider problem that's at play right now, in the sense that many countries are waiting for other countries to make those investments, get new drugs for which they'll be able to benefit from them once they're on the market. So all of that points to the need for governance at a higher level, global governance. And so, I'm an international lawyer, so I often then look at, is there a role for international law? Usually on most global health issues, I would say maybe not. I think in global health, we've been hugely successful using other mechanisms to address issues. But on antimicrobial resistance, because of the global collective action problems we face, I think international law has an extremely important role to play. And hopefully in the coming years, we'll be seeing more use of international law to address this challenge.
Thank you.
I would just add at the end that, of course, we're very bad at getting doctors to do what they should do. And that doesn't just apply to AMR. There's something about the behavioral sciences and education that we haven't cracked across all of medicine. And I hope that AMR and stewardship is one of the first areas we really crack that conundrum and understand how better to educate not just our doctors, but our nurses, pharmacists, vets, dentists, hygienists, everyone.
And on the topic of global governance, I'll just say very quickly, I've had a longstanding interest in Canada's role in global health, the Canadian Academy of Health Sciences strategy and so on. I've had a longstanding interest in WHO and its role in global health. And it's wonderful to see them coming together in such a vibrant way through York University. And also wanted to take the opportunity to acknowledge some of the other terrific faculty there that had already been mentioned. James Orbinski is basically a Canadian hero in global health. Adrian Veens, with whom I co-edited a textbook in ethics. And so what a great day, and congratulations to all and to York University.
Congratulations.
Thank you. We have another question here. I think people are just starting to warm up. Is AMR something that can be tackled simply through more research or funding, or is there a limit to what science can help with?
Well, there isn't enough funding and research, but actually we need all sorts of different sorts of research. And as I've already indicated, we need behavioral research. We need implementation research. We need research into how to have a sustainable supply chain. So there's a whole block of types of research that people don't always understand as science research, but they are scientific disciplines. let alone the need to understand how use in animals makes for a problem for humans or the planet, use in aquaculture, the spillover from manufacturing into the environment. I mean, I would say this is a worry, but where's the real hard evidence that it's causing ill health? Or will we wait until it hasn't caused such ill health and it's irreversible? So there's a terrific amount to be done. It does need money. But at the moment, the biggest need for money is supporting countries, particularly low and middle income countries, to develop their national action plans and make them a reality. And that, we've got the UK Fleming Fund, which is spending 265 million supporting people, but these countries need a lot more support, both in the laboratories, in the training, and then in data, how you collect that data, how you use data for action.
I'll just briefly add that I think this is one of those challenges where we already know enough to take bold action, but for which we need to know much more in certain areas to make sure that that action is maximally effective and sustainable over time.
Yeah, and what we're really talking about in a sense there is the cycle of panic and neglect, which is a cross-fertilized issue from pandemic preparedness and relevant to the present day. Tedros often talks about the cycle of panic and neglect. So I think what Stephen and Sally are saying is we panicked, let's stop neglecting and actually finance these plans and make progress.
Thank you. We've got another question. In Canada, just like many other countries, a significant portion of antibiotic use is unnecessary and is driving AMR. What opportunities do you, with this new center, plan to engage with healthcare providers or professionals, doctors, pharmacists, nurses, and the general public to support better AMR stewardship?
Yeah, so our goal at the WHO Collaborating Center is really to support the World Health Organization's efforts in this space. And really our focus is on very much about highlighting the global dimension of this challenge. And Canada, as Peter mentioned, Canada has a very important role in this, in providing leadership in global health, working with allies around the world. And of course, when we think of Canada, it's not just the government of Canada. We need Canada's health professionals, professional associations, societies, all coming together, highlighting the importance of this challenge, finding really creative solutions to address it. Because ultimately this affects all of us. And of course, there's people on the front lines of this, our doctors, our nurses, everyone who's working in hospitals and other healthcare facilities. But of course, also there's the public health professionals, there's the policymakers, there's the implementation leaders. So in that respect, our collaborating center, we hope to emphasize those global dimensions of this challenge and bring a science of global strategy to bear on how we can better support international collaboration between countries to address it.
Thank you very much. I think we'll wrap up with one final question. There's been a lot of work in high income nations around AMR, but I'm wondering what's the potential impact for low and middle income nations? And will they follow a similar timeline as high income nations? And do the strategies to reduce AMR need to be tailored for different nations and different regions based on their current status?
Dame Sally, maybe over to you first.
We all need a strategy for AMR in our own country, and it's called the National Action Plan. I think there are about 130 written, 50 more in preparation. And clearly, what is in that plan depends on, have you got access to the drugs you need? What is the disease burden? If your problem is mainly TB and malaria in the first place, then that will be higher up your list of reasons to take action and where. So a national action plan looks at the disease burden, the resistance pattern, the access issues, then how to move forwards with education and with working across all the sectors. We use One Health. I, like everyone else, don't like this term. It's too technocratic. I prefer planetary, but I think others got there first. But planetary then does do that convergent challenge issue. Because, of course, this is about it's about appropriate use of antimicrobials and antibiotics. It's about HIV, malaria, but it's about not using antibiotics for growth promotion in the food chain. It's about protecting people. So we all have to do our own, but two things are very important. The first is the study that Dr. Tam quoted from the World Bank, which showed that AMR will have its biggest impact as we go forward on low and middle income countries, driving more than 28 million into extreme poverty. So we all have to help them with their laboratories, their plans, and their actioning of this. As I said, we through the Fleming Fund are. But the second is we all have to work in different ways, collaborating across the world. And you're back to bugs have no passports, and we're going to need to think about our food chains as well in very different ways. Thank you.
And I would just add, Dr. McDonald, that, to go back to something Stephen said earlier and take a page from his book, he was talking about how this is a problem that affects everybody. And that does play into the universality of the SDGs. And I think that's a very important starting point. But I'd like to go a step beyond based on some of the lessons from COVID. One of the things I think we've learned from COVID is that it's turned the idea of North and South on its head. Quote unquote developing, quote unquote developed, quote unquote rich, quote unquote poor, because some so-called developing countries did extremely well with COVID, and much better than some so-called advanced or developed countries. And I think we have to have a lot of humility about that. And that does have to do with the muscle memory, I think, from SARS-1. It has to do with well-evolved contact tracing, for example, from Ebola or polio, immunization campaigns, but it also has to do with leadership, I think. And so just to say that while we're talking about, low and middle income countries, to me, that means something totally different than it meant 6 months ago, 10, 12 months ago, because of the experience of COVID. And I always knew that there was a lot we could learn from low and middle income countries and reverse innovation and so on. But I think COVID has really illustrated that. And maybe what the center might want to ask is, what are the good practices in AMR in so-called developing countries that actually would help us? And I just want to approach the whole topic and the whole question with that level of humility, going a step further than the universality of the SDGs, I dare say.
I know we're out of time, Dean McDonald, so I'll just a big thank you from, at least for me, for everyone who's joined the panel and for everyone who's joined this discussion. Dean McDonald.
Thank you. And I'd like to thank all of the members of the audience who sent in such thoughtful questions. And of course, to acknowledge the wonderful and thoughtful responses that were provided by our panel. I hope that everybody has walked away with a better appreciation of the importance of antimicrobial resistance. I'd also like to extend our thanks to special guests, Dr. Theresa Tam and President Lenton, for helping us today and joining in this celebration. And congratulations again to Stephen and Susan for working to create which is no doubt going to be a very, very important and exciting enterprise. And we're so pleased at York to have the opportunity to collaborate with the WHO and partners from all around the globe to address this important challenge. Now, to help us remember this important moment in time, I'm going to invite all of our special guests and panelists to activate your cameras and microphone, and we're just going to collectively toast the launch of the new collaborating center on antimicrobial resistance. So if you'll join me, please, and just raise a mug. In Canada, it's still early in the morning, so a mug is most appropriate. And congratulations to Stephen, Susan, and the entire team of individuals who brought this together.
Well done.
And with that, ladies and gentlemen, that concludes our program for today. And as we say, we hope that it's been of great value and interest to you. And I'm sure that all of those that are connected with the center would be delighted to follow up and maintain any correspondence with you if you have follow-up questions or ideas. Thank you again for joining us, and I hope that the remainder of your day and goes well. Thank you very much.